Well, first of all, I'd just like to say thank you for staying to the end, because it's a long day and there's a lot more people in here than I thought would be at this time of day, so well done, everybody. So I'm Mandy Brailey, I'm Infection Control Matron, and I work for Birmingham Community Healthcare. And as part of the COVID response, IPC from Birmingham Community Health was commissioned by the local authority, it's over there, to provide IPC support to our care homes for the adult care across the city, of which there was 280 homes. So it was a bit, started off, responding, because that's all you could do at the beginning, and then obviously it's got bigger. So what I want to do today is just share the work that the team and the care homes themselves. So obviously the results that you're going to see are the results of the care homes and the work that they've done to improve their IPC across the city. So this is just reflecting really on what we've done. So as I say, to start with, it was very reactive. It was about responding to outbreaks. It was, we were getting calls. You've got 3, 4, 5 outbreaks, and that's how we were doing. We were going out. I think within the first 3 months, we'd done about 50 homes responding, and there was, it was quite a lot of pressure. There were prompt visits. We were expected to go really within the next day, which we did manage to do, but it was hard. There was just the 2 of us to start with. We were offering IPC support, and obviously we were doing baseline audits so that we could get an idea of where the care homes were as regarding IPC, and then provide training for them. We had to provide an IPC report, and that had to be done quite promptly, because obviously all the stakeholders needed to know that information, so that we could work out what support was needed and if any other interventions were needed. And we'd signpost to resources and obviously, as I say, provide feedback. It was very challenging, as I'm sure you all know, and I'm sure the care homes know, but, the responses went from tears to fears. So, a lot of people, they didn't want us there. They'd gone from having nobody go into the homes to actually being checked and audited and policed by every organisation that seemed to be available. And my first meeting for the first care home I spent the first sort of hour and a half just sitting really with the manager owner, who just broke down into tears because of the amount of residents that she'd lost, got no staff. So there was all these sort of things. So really it was building those relationships and trust with the homes, really. We had increasing numbers of outbreaks across the city, and at one point it felt that it was just this constant battle. There was also conflicting advice, sorry if this offends, but obviously we would go into care homes, and then they'd say, oh, well, they'd come to the door with the whole hazmat and the gloves not touching, and then we'd say, well, can we just step back a bit? So they've got this group were telling them they need to do this, somebody else was telling them to do that, and then we'd go in and say, actually, can we step back and start from the beginning and work through? Turnaround process was tight, and obviously there was challenges with the mandatory vaccine of staff. So they were already up against it, and then a lot of their sort of very experienced staff were having to leave because they didn't want the vaccine for whatever reasons. But again, that was very difficult times for the home, and we kind of just had to listen really and try and be as supportive as we could. So this just shows an example of the audits that we have done, and this is obviously from March 21. We did start in December 20 originally, but March 21 to March 22, you can see the comparison of when we first started, the percentage. I can't actually see because I haven't got my glasses on properly there. Yeah, I think it was 17%, and then it went right down now in March 22. And again, that gap has got much smaller again as we've carried on. And the next graph just shows that the blue line is the initial audits that we've done. And not all homes needed a re-audit, but for the ones that did need a re-audit, you can see the red line shows that every home has improved in their IPC compliance. With with 2 homes particularly exceeding our expectations and having sort of like 25-30% almost increases in their percentage. And those were homes, particularly one that was a very old building. You know, we had to put a lot of training in. The building itself didn't change. What changed was the practices of the staff. They were stuck with the building and they just had to try and mitigate the risk as best they could. But their practices brought their score up, which was phenomenal, really, and, you know, down to their hard work. So obviously, as time went on, it was felt that rather than, you know, stop the service after the 3 months, there was funding still there. So to try and have a more proactive approach, obviously still supporting with outbreaks, but trying to be more proactive and get the homes to work together. So the audits and the action plans continued, and we used the IPS audit tool. And obviously that was agreed that we would do a baseline audit for all the homes across the city so that we've got a standard, so we knew exactly what every home was doing and where we need to target that training. We did targeted training for 145 care homes, which I think is about 164 now. I'm trying to remember my email yesterday, but I think it's about 164. We've developed an IPC website where all the information, all the resources that they need is available. We update it regularly. It's quite easily to access for anybody. So if you just Google Birmingham City Council Infection Control, it will come up and it's all sectioned. And we work collaborative with the Birmingham City Council to make sure that that, you know, was accessible to all. And we've developed the IPC Champion Programme, which I think has been a key part of this proactive development, which I'll tell you a little bit more. And you can see a couple of our IPC champions there and a couple of members of the team. And it was very difficult to try and do training during COVID with restrictions in place. But we felt that face-to-face training was essential because this is what the care homes felt, that they'd been abandoned, they were isolated, and the fact that we were going in and investing time in them was quite key, really. So we've had some successes. I think the care homes across the city have worked really, really hard. We've had collaborative working with Birmingham City Council, as I've said. 67 re-audits for homes not achieving green demonstrated significant improvements. Again, that is higher now. And there's not many care homes actually needing to be re-audited now because of some of the training that we've done. Improved staff morale within the care homes. I'd never seen people so enthusiastic to come to training. They were like sponges, and you know, we were fighting them off sometimes, saying we can't fit you in the room, you know, with social distancing. But you know, one home we stayed, you know, about 3 hours after our time just to get them through because they were just desperate for training. We had a consistent approach, so obviously it's the same audit tool, the same auditors going out to the same standard, and obviously the training package, we developed a package so that it's a video, but it's a face-to-face session, so we play a video with the standard precautions on, mandatory training, but then you've got that face-to-face interaction with the hand hygiene, the glow box, questions, but it's still made it consistent. We had positive feedback throughout from obviously the commissioners and the external stakeholders. The feedback has been exceptional. And job satisfaction for our team. We have absolutely loved it, haven't we, and thrived, I have to say. We just feel that we've had a really special time over the last 2 years. This just demonstrates, this is one of the audits that I was saying improved significantly just from their practices. And basically, they just didn't know. They hadn't had people go in. They hadn't got cleaners in place. They had, you know, people who had left during COVID and they hadn't been replaced. So this is just people where we put in a lot of targeted training, particularly about cleaning and decontamination. And this shows the scores. So obviously, they went from 62% to 91%, and that was in a month. That's all they had was a month. The turnaround for this was so tight to get the action plans out. They had to get an action plan back in that month. We had to do the training within that month and then go and re-audit. So it's all been quite tight, but they achieved. And I asked the team, you know, what do you think about the service? I did submit to the Nursing Times, and this was me asking the team, you know, how do they feel about it? And this is what they said. We've reframed our approach to supporting, not policing, and I think that's been the key. the key thing for us was to say to them, we are not here to check up on you, to police you. We are here to help you and to support you and do what we can to get you in the right place. And I think that's been the key factor here. We highlight the good stuff and then support and encourage ways to provide improvement. Providing the why is key. We tell them, we want you to do this because this is why you need to do it. And I think that has made such a difference. We adjust our approach to the training delivery to meet the needs of the homes. So you get a look at, the staffing groups, what are the issues within their audit, what can we target, what can we focus on. And this was, as I've said, the team feel privileged to visit the homes. We may enter as foes, but we always leave as friends. And I think that has shown from the feedback that we've had from the care homes. So, and it's the care homes that have done the work, So we're coming to the end of our sort of time. It's very sad. So we don't know what the future holds at the moment. We're hoping there's going to be a little bit more to see and do. But the legacy was, as part of this work, to implement the IPC champion. So we've held 3 IPC champion events across the city, and we've now got 112. I think it might be a bit more actually, but I think it's 121 now. But we've got over 100 champions across the Birmingham adult care sector, which has really had an impact on IPC. We developed a newsletter. We're now on our 4th edition of a quarterly newsletter. We commenced the IPC Champions Forums, which 2 have been Teams meetings, and we had 1 face-to-face forum, whereby, I will skip on, we've also developed a workbook, which is sitting with clinical illustration at the moment, but we held the forum with the workbook in draft so that the care homes could input on that workbook, so that we weren't developing a workbook that actually wasn't going to work for them. It was a workbook that said, yes, this is what we want and this is how we can use it. So we're hoping that that will be out by the end of the month, fingers crossed. We also held a World Hand Hygiene marathon, and Jean came to me and said, perhaps I could go to the care homes on World Hand Hygiene Week. I said, yes. And then she said, it's 2022, perhaps we could do... So, and I said, well, why don't we do 22 homes for 2022 with 22 champions? And the poor girl looked absolutely befuddled. So that's what we've done. But 251 staff participated in that hand hygiene glow box marathon across that week, and they thoroughly enjoyed it. There is a poster in the other room. It just gives you a little bit of feedback on that. Positive feedback again, and I've said about the workbook, and there's another one of our champions events. No masks on the next one, as you see. The masks have gone. And the IPC legacy, so the team have built bridges, and we've got really good relationships with the care home sector across Birmingham now. And I think it is a difficult time because it's difficult for them knowing what is going to happen at the end of this time, but I think they have made so many changes and implemented changes within their environments that I think they're doing really, really well. As I said about the champions, but this has also ensured that they've got a voice now. We've given them some, knowledge, we've empowered them, and they've got a voice to challenge things and raise concerns. But equally, the care home sector, we heard earlier, some people, they move around and they'll go from home to home. And what we have found now on our IPC champion events is, there'll be somebody that's actually, we've been out to a home, we've audited them, they've done the training, but then they've moved and they've taken that then to the next home. And then when we go and audit that home, we say, you've got the posters. Oh yeah, we bought those from. So you can see now, it is, going full circle, and that's really what you want, a standard across the city. And there is one of our champions that did just that. She moved from one home to get a promotion in another home, and she shared what she'd learnt and implemented changes. So we actually asked her if she'd talk, which again frightened her to death, but she did. She got up there and she was able to address the group of what changes she's implemented and how it had empowered her. So, just helping to improve the safety of all the residents, clients across the city. Just some of our lovely champions. And then some of the achievements I just wanted to share with you. Obviously, we wouldn't have been able to have these achievements without the care homes inviting us in and welcoming us into their homes. So we've had 3 VIP nominations, 2 oral presentations at IPS to showcase the work stream, positive feedback, as I've said, Nursing Times finalists for 2022. We didn't win, but hey, we were in the finals, and everything's good for care homes if you get in the finals, isn't it? And as I say, we've got really good working relationships with Birmingham City Council and the care homes now across the city, which is, you know, we're in a completely different place to where we started. So moving forward, we had the care homes were split into priorities. 1 to 5, there was only a couple of homes in 5, so we grouped them with 3. We're just finishing off priority 4. We've got 8 care homes left out of the 280, so that's not bad. We're on target. We're continuing to provide ongoing IPC and outbreak support. And as I said, we're launching the workbook, and the workbook will be a mandatory training workbook with questions that they'll be able to use for any new starters. It will also have catheter care management. It will also have some mouth care matters information and some food hygiene key facts. It's a little bit late for autumn, but more winter, I think. We've just held an IPC Champions event, which went really well, and we are looking at, in the future, we have had a recent forum with them, and this is something that, obviously, they need that support. We've developed them. We don't feel that we can just say, yes, you're an IPC champion now, you need to get on with it. So we're now looking at how we can put things in place to ensure that they've still got the forums, they've still got regular face-to-face training, we've still got the newsletter, so that they've still got that ongoing link and that ongoing support. And just to add in that the feedback from Birmingham City Council, the IPC has played a significant part in reducing the number of outbreaks, with Birmingham care homes amongst the lowest in England for care home deaths per 100,000 population. And this thank you, the person is in the room actually, but this thank you at the bottom meant the world to us, because it's what it says, thank you, not just for what you've done, but for the way you've done it, and that had such an impact on the team.